We are recommending, and the AAP and the CDC are recommending, that children under 2 come into the clinic and get their regular well child checks done. Here at Mary Center, we're focusing mostly on the 18-month-olds and younger in an attempt to make sure everyone stays on their schedule for their vaccines, starting from newborns until 18 months old. We give very important vaccines at the 2-month and the 4-month and the 6-month visits, also at 9 months, 12 months, 15 months. So, we don't want them to miss any of those vaccines, and we want them to try to stay on schedule as much as possible. So what can happen if children don't get their vaccines on time is that it puts them at risk to get sick from these diseases. And also, we know when our vaccine rates drop below a certain percent, around 90%, that we're putting the community at risk to have outbreaks of diseases.
Mm-hmm. And how can we explain parents who have children under 18 months old that it's safe to come to the clinics?
Right. So most pediatric practices are trying in some way to separate, again, the well from the sick. And some practices are seeing the well kids in the morning and the sick kids in the afternoon. Here, we're totally separating the sick from the well. And the doctors as well. So the doctors who see well children are only seeing well children for that period of time. We're also making sure that everyone is wearing masks at all times in the clinics. We don't recommend you put masks on children under 2, but the parents and everyone else in the clinic is wearing a mask, and that helps protect everybody. We're also really working hard to disinfect the rooms between children, and also the waiting room is being disinfected and cleaned, thoroughly.
And what happens to those children who are over 18 months old or 2 years old and need vaccines?
So what we're doing is we're still seeing children by telephone and televideo visits for their well children checks. So we're trying to keep everybody on schedule, even if it's just a telephone visit. And then we're doing a second visit. We're scheduling a second visit for their weights and their heights and their vaccines. We anticipate, hopefully in the next 2 months, we'll be able to start seeing everyone again, or at least bring back children who are due for a vaccine.